Hello, this is Dr. Sargisian, and I'd like to talk to you about Beer's List. In 2012, American Geriatric Society updated the Beer's List, and currently we're using those recommendations. The list is very complex. There are more than 30 medications on that list, so how to remember? It's fairly easy if you try to categorize, and list actually divided into three categories, and we need to know what are those categories. Category number one is the category to completely avoid in elderly populations. Category number one, first category, has pronounced anticholinergic effects. The good example or the best example or most commonly used example from this list is diphenylhydramine or Benadryl you can buy in any retail pharmacy over the counter. Unfortunately, when you use it for your elderly patients, this can exhibit pronounced anticholinergic effects, and your patients will experience dry mouth, dizziness, or even falls because of that. So try something else. Another medication category from that first section is benzodiazepines, hypnotics, anything that can cause dizziness, drowsiness, but again, anticholinergic effects, that the property that puts medication into this first category. So second category is devoted to medications to avoid under certain condition. For example, your thiazolidinediones are still good medications, and FDA lifted the ban from them recently, but still probably not a good idea to use in patients with heart failure. Third category is the medications that you have to use caution when you are prescribing those, but you still can use those. Example is aspirin. Aspirin, we know that we prescribe it all the time to patients to use as prophylaxis for cardiovascular events, to prevent those events. But if your patient is over 80 years old, the potential benefits and risks, they don't really match. The risk for adverse events may be higher than actual benefit that it will bring to your patient at that age. So again, just to summarize, three categories. First category is to avoid by all means. Second category, to avoid in certain situations when your patient has pre-existing health condition that medication can make worse. And third category is to exercise caution. And you may exercise caution because the benefits are not so certain for elderly patients. So this is it, and thank you for listening, and I will see you next time.